Hi everybody, Dr. Shakov here at the Youth Fountain in Freehold, New Jersey.
There you go.
Alright, and here today we're going to be doing a number of treatments on the beautiful Dr. Rada, the other doctor in our practice. Today we're going to start by doing some toxin injection. We're going to be treating her brow, her forehead, as well as a little bit of lines underneath the eyes. And then we're going to also do a Nefertiti Neck Lift as well, which requires it's on the lower part of the face. And then after we're done with all the toxin injections, we're going to do some filler injections. We're going to do a little bit on her lips, right in the corner on the top lip there. And then we're going to do a little bit on the cheeks, as well as the nasolabial folds and the marionette lines here. So let's go ahead and get started. So we always, before we get started, we go through a series of steps. So the first thing we like to do is put topical anesthetic on patients. This way it lessens the needle sticks and it makes it a lot more comfortable having the procedure done. After we do that, then we go ahead and we remove the topical anesthetic and we cleanse the skin as well. With a skin cleanser, we like to use Hibiclens. What it does is cuts down on the risks of infections.
And we always do before and after photos.
Yeah, that's definitely a must. So go ahead. Are you seeing
Yeah,
okay?
yeah.
Okay. I'll go ahead and frown for me.
Actually, your shoulder's in the way.
Okay, all right. Okay, frown again. Relax. Frown again. Go ahead, relax. Frown again. Frown again. Okay, go ahead, relax. Frown again. Go ahead, relax. Okay, all right. So you went ahead and treated the brow area. Next thing we're going to do is treat a little bit underneath the eyes. It's got some small little lines here.
Will Bruno 8 sent a request to be in your live video.
To be in the video?
Mm-hmm.
What does that mean? Does that mean they want to actually be in the video?
Yeah, like the screen would split and then they would actually.
And a little bit more on this side. Alright. Feel anything on those injections?
You're wonderful. I usually do my own injection, so
Yeah, today she gave me the privilege of getting to inject her, so I feel very special.
I do it for the people. I've done it for you, my fans.
Okay, now I'm going to move on to doing her forehead. So go ahead, raise up your eyebrows. Okay, go ahead and relax. So it's important when you're doing the forehead that you don't go too low. Because if you go too low, you can drop the brow. So there's a line right here that splits the forehead into 1/3 and 2/3. So generally stay above that line. I always ask patients to make the facial movements, like with the brow area, for instance. I always just like to see how the lines form where the muscles are, so I can do a more accurate injection. And same thing with the forehead. I have patients lift up their eyebrows. That way I could see where the line, where the main parts of the muscle are. And also, everybody has different types of frontalis muscle, which is the forehead muscle. There's about 4 types of them. So this way, by evaluating how patients can raise their brow, we can see how the different type of muscle that the patient has. And it gives us for a more accurate injection.
He sent another request to be in your live video.
Was that?
Wilgen Bruno?
Why? I'm not really sure why they want to be in our video.
Okay, go ahead, raise up your eyebrows. Okay, go ahead, relax. Huh? All right. So the upper part.
How often do patients need these tox injections, Dr. Shakov?
So generally the product is going to last 3 months, but that doesn't mean that you need to have an injection done every 3 months. So what happens once the product takes effect, it's usually about 3 to 7 days on average. Then the muscles will start, or they'll move less. So once you get that decreased muscle, then you're going to have the lines are going to soften. Because the lines are formed from the muscles contracting and it pulls on the skin, and that's what creates the forehead lines, the lines in the brow area, as well as around the eyes. Okay, so next we're going to do the Nefertiti. Alright, so next we're going to move this out of the way. And now we're going to do the Nefertiti Lift. And that involves the platysma muscle. We're basically doing the same process that we do on the upper face, more specifically brow and the forehead, by injecting the platysma muscle, which is the main muscle or the surface muscle in your neck, and it extends up to the lower part of the face. Once we inject that, we can actually create a nice jaw slimming. That way it releases the pull that it's doing on the mid part of the face, just below the cheeks. You want to move your head back a little bit?
Whatever's more comfortable.
Yeah. No, I mean like just lean back, yeah. Go ahead and frown for me. Okay, go ahead and relax. So this first injection that I do here, this is called the DAO. Or, what this muscle does is it pulls on the corners of the lips. By injecting it, you can cause the patient's lip to, especially if they have that resting frown face, it'll cause that to relax.
We don't call it resting frown face. We call it resting bitch face.
I was just trying to use a more friendly
It's fine. I
term.
accept who I am. I
for
do
it.
have RBF. It's okay.
All right, and then the next series of injections are now for the platysma muscle. So important thing is you want to stay below the mandible because you have a marginal mandibular nerve that's right in this area over here. So if you do inject it with any kind of product like Botox, Jeuveau, or Dysport, you could make that nerve stop working, and then that can really affect the way a person can use their lips.
Evan said hi, Papa.
Ah, tell them.
Hi, Abby.
Hey, Evan.
Why not hi, Mama? What's that about?
Hi, Mom. From home.
The important part about when you're doing these injections is that you don't go too deep, because the neck has a lot of critical anatomy. So if you do go too deep, you can potentially hit a blood vessel if you're not aware of the relevant anatomy. So you just really want to get the needle just down into the muscle. So go to the other side.
Now it's Aiden saying hi, Mom and Dad.
Hi, Aiden.
Hey, Aiden. All right, go ahead and frown for me. Relax. Okay, so same thing. Inject this muscle right here, the DAO. Almost done. Okay, last one. That's it. We're done with our neurotoxins.
I feel it working already. No, it doesn't work that fast. It doesn't work that fast. 3 to 5 days, up to 2 weeks.
Okay, so next what we're going to do is the fillers. Dr. Shakov, Dr. Rada, is her complaint is she wants a little more volume in her cheeks. Sorry. She wants a little more volume in her cheeks. Now, she has a really great cheek structure as it is. She has a lot of great anterior projection of her cheeks. So what we're trying to do, and this combines with the facial slimming that we're doing with the Nefertiti Lift, is we're going to give her a little bit here at the zygoma, which is the bone here, part of the skull. So by enhancing that, what we're trying to do is create a little bit more of that V shape, which is the more youthful face. So by adding a little bit of volume on both of these sides, we're going to create more of that slim kind of appearance to the face. And once the Nefertiti Lift takes effect and the platysma releases its hold off of the this part of the face, it's going to create an even more enhanced facial slimming.
We call that part of the cheek a highlight. Because when we put makeup on, we like to highlight that area, and when the light hits it, it looks really nice. What other options are there for facial slimming, particularly jawline and chin?
There's a number of different procedures we can do. So if patients have a fat pocket that's underneath the mandible here, submental area more specifically, we can inject it with a fat dissolving agent. Now there's a product on the market, it's called Kybella, which is deoxycholic acid. So deoxycholic acid or phosphatidylcholine are two different options that can be used. Sometimes it's referred to as a mesotherapy. So that product will actually burn the fat and break it down through a process called lipolysis. And over time, that fat that's there will decrease. Another option you can do to change around the facial contouring without using the injections is Threadless. It's one of my favorite procedures to do. And what's involved with that is putting in what's called Pdo Threads. Now these threads, they are made of Pdo material, which lasts for about 6 months to a year, and it basically the body reabsorbs it over that time period. Now the great thing about the Pdo Threads is it stimulates collagen formation. So you get an added effect, not just of the pull in the lift, but you get collagen, which will replace the thread, and that'll create more long-term solution for that lift. But the most exciting part of the threads, once they get placed in, they are, first off, they're unidirectional, meaning the barbs on the thread go in one direction. So for when we're doing the jawline contouring, usually make a very small incision right underneath the ear here, and then we will put the threads along the mandible or the jawline. Once they get placed, then we do the pulling action, and once the pulling is complete, then you get a real nice immediate contour, and patients can see it as soon as we're done with the procedure. We show them with the mirror and they can see. And usually in the middle of the procedure, I'll do one side of the face, and they can see it compared to the other side of the face. So that's a little bit more of an invasive option. the most invasive thing you can do to create even more contouring of the jaw, but more specifically because you're getting rid of the excess fat that's there or even at the jowl, is you can do liposuction. So there's different kinds of liposuction, different energies that you can put with laser. You can also do radio frequency. Here at the Youth Fountain, we offer laser liposuction. So through some small incisions right in the corner here and also right centrally, we can do liposuction, laser liposuction in this area underneath the jaw, which will help contour and get rid of that excess fat. Now, what makes the laser liposuction better than just standard liposuction is that the laser works in two different fashions. The first part of it will heat the fat that's on the inside, and that's going to cause also less blood loss. And then it makes it easier to do the liposuction part, which is where we remove the fat. The final part of that is there's another laser setting which heats the skin from the inside, and that creates the skin tightening. Now you still have to wear compression just like if you got traditional liposuction, but you get a much better result from doing that. Okay, so here when deciding where to inject the cheeks, so there are typically three different points that you can inject, and some physicians will also use cannulas. I'm particular to using a needle because I like to be able to place the product in deep. I don't want to have to dig around with the cannula to get down to that area. Now cannulas can create a beautiful result just as well as a sharp needle. When we're injecting in this area, it's very low risk of any vascular injuries that can occur, so it's a relatively safe spot to do the injection. And here I'm using a product, Resytlane Lyft, and what Resytlane Lyft does, it's a heavy G prime product, meaning it creates a lot of lift, hence its name, with just a little bit of volume. So you can see just that really that one point of injection there, what kind of augmentation or shape change that it creates. Really nice. Basically, we're enhancing her cheekbones here, most specifically the zygoma, which is right under this area. So now you could see the difference in the shape compared to the other side, which we haven't treated. Now, sometimes we do get a little bit of bleeding, but it's very minor. Bruising is fairly low in this area. And this way that I did this injection, we don't even have to do much molding. It just went right in the perfect spot for it.
Someone asked, do you work on skin pigmentation?
So
Yes.
for, yeah, absolutely. So skin pigmentation, we can manage it in multiple ways. We could do, yeah, actually, yeah, so for skin pigmentation, depends on how extensive it is, but we can do some mainly energy-based treatments. So the first one is IPL, which is intense pulse light. What it does is the light will destroy the pigments in the skin, and that'll lessen the altered pigments on the face. The other treatment we can do is with the laser. We like to use Picogenesis, which is an absolutely great laser. Not only can we treat the skin pigmentation, but we can also use it to improve the skin tone and texture. It's a great, almost lunchtime laser. There's very little downtime. You might have some temporary redness with it. And then finally, another good treatment for skin pigmentation is a chemical peel. Chemical peel has a little bit of downtime because it takes about 7 days, give or take, for the whole peeling process to take effect. So if you do have the downtime, a chemical peel is a great, almost one and done. Depending on how the pigmentation on the face is, we might need to do 2 treatments. We'll generally space them out about a month apart.
But I would say that anything that you do for your skin requires maintenance, much like we get our nails done or our hair done. skin cells do turn over, and to maintain the effects, much like injectables or any other things, doing these treatments, whether it's laser or IPL or chemical peels, 3 to 4 times a year is often advised to keep the results looking good. Because unfortunately, we can't stop aging, and we can't stop the effects of the environment or lifestyle on skin or face. So that's important to know, that it's not necessarily one and done and never, and you're always going to look like that. That's not how it
Dr.
happens.
Patel, Sunita asked, does Hifu, Hifu, work as an anti-aging?
The typical treatment with that therapy has been the leader in that energy device. So what a high frequency ultrasound does is it will stimulate collagen in the skin, so it'll create a tightening effect. Now it's using ultrasound energy to work on the surface of the skin as well as within the dermis of the skin, the deeper layer. So the good thing about that treatment is it can be directed as far as how deep you want the treatment to go, or how superficial or close to the skin you want it to go. So from an anti-aging standpoint, anything that we do that cuts down wrinkles, tightens the skin, improves the skin texture, that's all anti-aging. So definitely treatments with high frequency ultrasound are great alternatives to lasers or microneedling. So now we're going to do the same thing on the other side here. So here I go right down to the bone and put like 0.1, which is a very small amount, and then I also do a little bit just above that area.
If you can multitask, Dr. Shakov, someone asks, what's the cost for this previously to the skin pigmentation?
For treatment of skin pigmentation? It depends on what treatment we're doing.
Inject, I'll tell the prices.
Okay.
So,
will you be able to talk?
yes, I'll be able to talk at the same
I'm
time.
going to do the piriform.
Oh, then I'm not going to be able to talk at the same time.
All right. With skin pigmentation, it depends on what we're doing. So a chemical peel, we've got 2 different strengths of chemical peel.
3 different strengths.
Or 3 different strengths. And that can range from, I think,
250 to 350.
Okay, so 250 to 350. If we're doing a laser treatment with the Picogenesis, I believe, what is it,
600?
Okay, so Janelle is our wonderful medical assistant. If you want to come up front, you can wave to everybody. No, she doesn't want to be famous.
Picogenesis is 5, Secret RF is 6.
Okay, so that's the range
and
of prices.
IPL is 250.
So around $200 to $300 on the low end, and
but if
as
you
much
think
as
about all
$700
the
on
junk
upper.
creams that all of us have in our junk drawer, and the amount of money we've spent on them, these treatments are much, much more worthwhile and much more effective.
Right.
All right, so next what I'm going to be treating, so nasolabial folds. It's this area over here. So most of the time when injectors are performing treatment in this area, they'll typically just do a more superficial injection, which doesn't get rid of the defect that's here. This is the piriform fossa. So by not injecting that, sometimes what you can have, depending on how deep the nasolabial fold defect is, you'll get a nice result along the bottom part. But right here, you'll still have a defect. And most of the times, providers or injectors aren't aware to inject that area to get a good result, or they don't want to inject that area because of fear of vascular injury. Now, the good thing is, when injecting into that area and when you understand the anatomy, the facial artery passes just above that where it becomes superficial. The injection here is extremely deep, right down to the bone, and there's minimal risk of vascular injury to this area. Now, because the product I'm using, Resytlane Lyft, already has lidocaine in there, patients may feel numbness to their nose after the injection is performed. And the important thing is the direction that you use when you're making that injection. to avoid it from getting into the infraorbital artery, which passes just lateral to that area. Okay, and the other thing that I like to do is I like to put pressure right here. It's in order to shift any blood vessel that may be a little bit lower there. Okay.
Mm.
Good. So you could see right away that one part injection there, how now I really don't think I even need to inject on the nasolabial fold because it raised everything up and it softened that nicely all through one spot injection there. How's that feeling? Right, and so I'm going to do the same thing on the other side here. Okay, so same thing. You could see before I did the injection, I would have likely have had to have done a good amount of product into this area, but because I raised up the piriform fossa, now I don't even have to do any injecting over here. I think we got an excellent result without having to do that. Are you feeling okay?
Let's not talk about that. It's spicy, kids. Even with a little bit of numbing, that area is very sensitive. So when people ask us, does it hurt? It's very minimal discomfort, but there are some areas that are much more sensitive on the face, and you have to be aware of that. But you know, it's momentary and the results are worth it.
Yeah, and well, with this particular product, you're going to get about at least 1 year of a result from it. Usually longer. Now there's studies where they've looked at even products not Resytlane Lyft, some other lower G prime. So the G prime is what gives the firmness of the product in order to lift tissue. Where they've done with biopsies or looked with ultrasound, sometimes these products can last 4 to 5 years. We usually tell patients 6 months to 9 months with for instance Versa, and with Resytlane Lyft about a year plus, but it could last longer than that.
Absolutely. I've had patients have lip filler and come back in a year after Versa and it still looks amazing, so
Yep.
yeah.
All right, let me have you lean back. So next, actually go ahead and move forward a little bit. Okay, so when evaluating this lower part of the face, when patients lean back, all the tissue goes back and it creates its own version of a lift. So we don't get to see how gravity is affecting the face. So the reason I had her lean forward is so that I could see this area much clearer, and that way I can do a more accurate injection, knowing how much of a correction I need to do. I'm just going to actually have you flip. We're going to need some more product in a second here. Alright, so a little stick here. Go ahead, open. And so what I like to do is mold the product on this side. So we got a nice little correction over here. So let me grab, I've got to get another, do you want to go ahead and talk? Do you want to get another syringe?
Sure. What do you guys want to talk about? Now that Dr. Shakov left the room.
What's the healing process?
For what? The lasers?
For lasers. Let's go with lasers first.
We'll go with lasers. So really, downtime is very, very minimal. I always tell people if they watched Sex and the City, that episode where Samantha goes to get like her Fraxel and she looks like Freddy Krueger, that is never what happens with the lasers that we offer. So downtime is very minimal. Look, they invented concealer for a reason. And when we do skin pigmentation, you can apply the next day some concealer to the spots. When we say downtime, you can still go out to work, go and, socialize as much as you can in this era of COVID, but you can still do things like, daily tasks. It's not like you have to stay home and hide under the covers. So it's very, very, very minimal. Chemical peels, there's peeling, but it kind of almost looks like a sunburn, and you can actually apply makeup over it. I don't recommend it because if you're peeling, you just don't want to utilize any makeup over it, but it's very, very minimal. And like Dr. Shakov said, a lot of these are lunchtime procedures.
All right, so we already see. So with the little amount of product that I placed here, we already got an immediate lift. And the reason for the molding was just to make it a little flatter. Now, patients may feel a little bit of some lumpy kind of sensation until the product settles. Also, there will be some hydration of the filler. As it settles, the body's own fluid is going to accumulate around that area, and it's going to volumize it even further. So it's important how much product that you put in, because if you do too much, you'll get an overcorrection, and then what it's going to do, this area is going to be raised up. It's not going to look great. Now, we've used many different types of fillers in our practice, and using a product that's too low G specifically, you will need a lot more volume there just to even correct a small amount. And so this is one of those areas where patients will be like, well, it's only a little bit, but it holds a lot of volume in this area in order to correct it. So the great thing about a product like Resytlane Lyft is a small amount of it will improve the little bit of that defect that's there, because the product sits basically where you inject it.
My nose is numb. That's a weird feeling.
Okay, yep. So the numbness is from the lidocaine. That'll generally last about an hour and a half to 2 hours. Okay, so now we're going on the other side. So this is another area that you can use a cannula for as well. Go ahead, open. Okay, so I'm just molding it out just to flatten it out and spread the product in that area there. All right, good. Okay, so I think we got everything with filler, right? All right, so we went ahead and we did a lot of treatments with the different injections. We treated Dr. Rada's forehead as well as her brow, as well as the little lines underneath the eyes here. We did cheek augmentation, and then we also improved. Oh, and then lips. Oh, all right. Yep.
Can't forget the lips.
Definitely not.
And I'm super numb. I don't advise putting on makeup immediately after injections. I know a lot of times people are getting this done in between working hours or before work or whatever the case may be, but we are putting little tiny needle holes in your face, and for sanitary and infection purposes, we do recommend avoiding any makeup products for at least a full day.
Yeah, because these needle marks, you could potentially irritate them. You could also potentially create an infection. So that's why it's important, especially with filler, because this is an implant. It does stay in the body, specifically where we inject it, for as short as 6 months up to a year or longer, or have a more lasting effect. So if you go ahead and put makeup immediately after, you could potentially create an infection, which will travel down to the filler. So that's why, like Dr. Rada had said, it's advisable to avoid putting on makeup, especially immediately after, until those puncture marks heal.
And avoid going to work out or anything strenuous for that day as well.
So now what we're going to be doing is, so Dr. Rada already has beautiful lips, her top lip to her bottom lip, but what she's most concerned about is right here in the corner here. So this is a very small augmentation where I'm going to just put it right in the corner, and that's just to lift out the edges, bring up the top lip to the bottom lip, so where they naturally should meet, I'm going to create a little bit of volume over into that area. For this one, I'm using a different product than the Resytlane Lyft. that's just way too heavy of a product to put into the lips. Create too much stiffness, too much volume. So for this one, we like to use Versa. Versa is, as the name sounds, versatile. We could basically inject it all over the face. But we, here at the Youth Fountain, we like to use Versa in two main areas, for lips and underneath the eyes. When you've got a lot of loss of volume, sometimes patients have a mild degree of under eye bag, and then that creates a line there. Also, there could be a line that goes from underneath the eyes down to the cheeks. That's the nasal jugal line. So by treating underneath the eyes there with filler, we can definitely improve that area. Now, one word of caution when treating underneath the eyes is you can get what's called Malar Edema. Even in the best hands, that happens to the best injectors. So what that is specifically is from putting filler underneath, and if you're overzealous, you overfill, or sometimes patients just have altered lymphatics. The lymphatics are like, they're basically the blood vessels of the body that remove and move fluid around. So filler sometimes can cause a compression into that area. Or if you put too much product, you can create that. So what Malar Edema specifically is you get an abnormal swelling that will appear on the upper part of the face, around the cheeks, and underneath the eyes. In those instances, it can be treated in a pretty rapid fashion, and that requires a dissolving agent in order to remove that. But I always explain that to patients before I do treatments for that area. Plus, the other part with under eye treatment is I always do what's called an undercorrection. We can't inject it to get it 100% corrected, and some patients you may never be able to get it 100% corrected, because too much correction can lead to those issues. So in some patients it might take 2 to 3 treatments in order to get not a perfect result, but a very good result.
An improvement.
Definitely an improvement. Okay, let me have you inject. You want to go ahead and use the...
Yes, please. All right.
All right, so there's many different ways of injecting lips. So if I was doing a full lip augmentation, I may do different treatments where I treat across the wet dry border, which is just where the red part of the lip meets on the mucosal side. There's a line of demarcation. So you put volume in that area, and that'll create a curling effect on the lips, and it'll push the lips upward, create volumization. When patients don't have much volume on their top lip, generally I'll go ahead and place a little bit of product there, which will improve the shape and the size of their lips. When patients do have more volume on their lips and they want more shape, or more vertical height, then we use a little bit of a different technique where we'll inject along the vermilion border into the very superficial part of the lip, and that will raise the lip as well as make the vermilion border more pronounced. Other great ways of shaping the lips, sometimes I'll just do the definition of the lips. So here, this is the vermilion border, right along here where the lip and the skin of the lip meet together. So just injecting along into that area will create almost like a volumizing effect without actually adding volume into the body of the lip. And that creates a really nice shape to it. But here what we're going to do is right along the lateral part of her lip. And so what I do is I distract it up a little bit here and just give a little bit of a stick. Just go ahead and inject a very small amount.
What are we doing after the fillers?
So that's going to be the PEP factor for the scalp.
Okay.
But I think we'll take an intermission while I get Dr. Rada prepared. So you can see right away that small amount of product right there, it moved, or it lifted up the corner of the lip, and now she has a much better corner of her lips. It looks more natural as far as these parts coming together. So we're going to go ahead and do it on the other side.
You can project the way I like it. You know what I'm talking about.
Yeah, I'll have you take a look at it in the mirror. And so I'm going to do a little bit over on this side now. Okay, and then it's important is you want to mold out the product so that there's no lumps left behind. All right, so we're going to take a slight intermission as I get Dr. Rada ready with some blocks in order to do the scalp path factor. All right, so let me have you take a look and see.
And